Hello and welcome to Your Health in Your Hands. I'm Dr. David Ajibade with the Brain and Body Foundation. Now, a few episodes ago, we had Dr. Hall on and we talked about the health disparities or the challenges, the health challenges that Black people have compared with whites. And it was a fascinating study. We addressed so many different things. We looked at different areas, everything from prostate cancer to kidney disease to genes and all those things that kind of explain why Black people are at a disadvantage in certain health conditions. I can tell you what health condition they are not at a disadvantage of, and that's probably skin cancer and maybe osteoporosis, which seem to have much stronger bones and stronger teeth, and maybe some other areas as well. But when it comes to the big ones like heart disease, cancer, diabetes, even brain disorders, we seem to have won the jackpot where that is concerned. So that's really terrible. Mm-hmm. But we have to begin to learn how to live intelligently. The reason why we're doing these shows or these episodes is to point out these things so that you can make intelligent decisions, take intelligent actions, starting early, start doing the right things on a daily basis or maybe on a weekly basis to ensure that I don't like to use the word prevention as much as I like to use the term building strength. You want to strengthen or optimize your brain. You want to strengthen or optimize your heart. If you know that this is important for your body, it's your responsibility to get it and take it, whether or not you're at risk of kidney disease, like Dr. Greg talked about, or heart disease, whether it's even exists in your family. An intelligent human being, once he knows that he's at risk, or once she knows he's at risk, he or she will take the right steps. And that's what we're trying to do here. We're trying to give you those steps, help you understand what the risk factors are, and strengthen your body even in your 20s and your 30s, even at the prime of your life. You need to start taking these steps now. And one of the things we always talk about, again, is vitamin D. We talked about we talked about zinc in the last episode. We mentioned magnesium as well. Today, we're going to be talking a lot about certain kinds of screening. We're going to be looking into colon cancer. We're going to be looking into some lung cancer. And depending on the time, we'll look at some other things as well. So welcome back on the show, Dr. Hall.
Thank you so much for having me back. I appreciate it.
How are you doing?
Good. I feel good.
Good. So let's talk about, let's talk about lung cancer. No, let's talk about colon. Okay, so edit that out, Yiga. So how about we talk about colon cancer, since this has become a very important topic, especially with the loss of Chadwick Boseman, the famous Black Panther star.
Right. Yeah. And that, since I wrote an article on my website, Dr. Greg Hall, and I also learned that Pele had a colon cancer. A number of people.
No, yeah, really?
Yeah. I mean, he certainly lived to be older, but that was an issue as well. And so, but colon cancer is, it's one of those cancers that certainly we have an increased risk for a number of reasons, right? Some of it's genetic, some of it's dietary, some of it's not getting screened as we should. Some of it's having a fear of someone putting something in the out hole only, right? There are people that hole is for out only. No one's sticking anything up in that hole, right? And so people miss out on get diagnosed with cancer because that hole is for out only, and that's a problem, right? That sort of attitude, which a lot of people have, a lot of my patients have. What's neat about prostate cancer, we talked about the last time, you can draw a blood test and screen for prostate cancer with a test called the PSA. And that's a blood test, so you don't have to do a rectal exam like I used to do at the beginning of my career. But with colon cancer, a colonoscopy is the best way. Having a scope that goes up your bottom and takes a look and actually can see if there are any precancerous polyps or any precancerous lesions in the inside of your colon. And when they see those, they can take that out, and then it doesn't turn into cancer. And so I always see colon cancer is like the ultimate sort of preventable cancer, certainly the most easily preventable, because you don't have to have surgery, you don't have to be opened up. And if if they look and it's all clear, you can go another 10 years. And so colonoscopy is the best way to be able to do that. Yeah.
Could you explain what a polyp is for our viewers?
Yeah. A polyp is just a small outgrowth. I think of it as almost like a mushroom that's growing on the inside of your colon. And that mushroom can swell and ultimately become a cancer. When it's small, it may just be an incidental finding, right? It could be nothing, or it could but some of those small mushrooms on the inside of your digestive tract can grow and turn into a cancer. So if someone's in there looking with a scope, they can actually snare that mushroom, pull it off, and take it out, and then it doesn't grow into anything. And so it's almost like kicking a mushroom off. If you see something, you kick a mushroom over, it's done. It's not gonna,
right.
So and that's the same sort of approach with the colonoscopy. You can find these polyps, which are little mushrooms, remove them, and then they don't grow into a cancer that once it grows through the walls, now you need major surgery. Now you need chemotherapy or radiation. Now it's a big, horrible mess. Whereas if we had found it when it was small, like weeding in a garden, you find one weed when it's small and you pull that out, you don't end up with a whole mess of weeds when it's a big problem. And that's like cancer metastasizing, cancer spreading from one region to another. So it's just preventative and proactive is really the answer.
So yeah, absolutely, that makes perfect sense. Unfortunately, most of our viewers may not have access to those high-tech colonoscopy where you have it, because you need the experts, then you need the equipment, and then you need the hospital or the center in which to do that. That is not, unfortunately, that is not available to most of Nigerians. Unfortunately, sad to say. So let's talk about some of the obvious signs, but before we go there, let's also talk about what the recommendation is that starting from the age of 50, I understand, in the US, but I understand 45. Because 45 is what I'm hearing now for Black people, right? Is that right. Correct?
Because of the increased burden and the increased occurrence of colon cancer. And so one of the issues with Chadwick Boseman, he wasn't even 45 when he died. So we would not have even screened him unless he had which wouldn't have been a screen if he had a complaint. So it's unfortunate that this was going to happen almost regardless in him, because we would never have screened him because he was even younger than 45. So he had a young, aggressive cancer.
But he would have noticed some things, though. Maybe he overlooked those issues when they were very minor. He just kind of
smaller. Exactly. Yeah. No. Well, you would have abdominal pain. You'd have constipation. You'd certainly have constipation early on. As that polyp or mushroom grew, it starts to block the transport of things that are coming through your colon on the way out, right? And so that's slowing those things down. Sometimes you'll see blood, that thing will cause blood. And you can also do screening of, I don't know how available Cologuard is, but that's a sort of a screen not available as well. And then the tests where they kind of take the stool and rub it on a piece of paper, and you can see if there's blood there. And if there's blood, sometimes that'll make you think if it's not a hemorrhoid, that there may be some early cancer or some tumor that you can screen for.
Okay. And then, blood tests check the red blood cells as well. I mean, the PCV, hemoglobin count, and all that. Okay. Yeah. It's shocking. They're saying that those numbers are increasing rapidly. Why do you think the numbers of people having colorectal cancer is increasing?
Well, I think we're detecting it more, to a certain extent. I mean, there's some people that are dying and we don't know what they died from, and they just say they died of a heart attack. And as we're able to detect more, we're able to be more specific about what it was that they actually had. There's some belief that diet is related to, and certain deficiencies are related to colon cancer. We mentioned, I think, in the last program that, that vitamin D deficiency is related to increased colon cancer. And as I mentioned, a strong immune system is able to suppress cancer. And so as we get to the point where our immune system is not as strong, then our ability to suppress cancer is not as good. And your immune system works when you sleep. So if you're not getting a good night's sleep, or if you're not in an environment where you can get a restful night's sleep. I mean, I grew up in the inner city. My bedroom was on the front of our house, and the front of our house was on a major street, a major urban street. I slept like a baby when I was young, right? But if I was old like I am now, the siren coming by, we didn't have air conditioning. The window was open, and I was right on the street, And so not getting a good restful sleep can impact your immune system. And if your immune system is related to fighting off infection, as well as keeping cancers at bay, that is also a big issue.
So here's another thing too, with staying near a highway with all those cars passing by, the fumes, the pollution, the toxins you're inhaling. That's another thing.
Lead, and it's a wonder I'm alive still.
Well, I'm sure you had a good immune system. So so that's interesting. So make sure you edit this pause out that you got. Okay. So anything else that we need to talk about with regards to colon cancer before?
Well, I just think that colon cancer is preventable, and I think we need to figure out a way to make access to the things that are available in Nigeria. We need to find a way to improve the accessibility for some of these things out there. But again, the low-lying fruit thing is related to nutrition. Increased meat has been associated with red meat, beef, lamb. Those things are certainly associated with increased colon cancer. Increased fast food has been associated with
the ultra processed foods with all the salt and chemicals they add to it.
Right, those things are all drivers as well. Yes. So
this other thing too that's I see as important, the whole thing with fiber, both soluble and insoluble, and I've become really big on it because of my studies as well. I mean, I try to take five. I mean, it's good to take your veggies. I think it's 5 to 9 servings of fruits and vegetables. I don't know who does that, especially raw veggies a day. So what I try to do is I try to hack the system by I searched for a long time, and eventually I got something at Whole Foods where you can. It's a fiber, organic psyllium husk fiber, which works really well for me. It may not work for everybody, but a lot of my patients have used it and they enjoy it. And it helps you get more regular. It helps the stools. I know I'm being a little graphic now, but the stools are much better formed. You don't have to wipe many times because it comes out very well. You know what I'm saying? And so I think that's important too. I think one of the problems with colon cancer, and I'm not an expert in this, is that many of the foods we eat tend to just sit there, and the transit times are much longer, and so there's a greater chance for them to do damage, for those toxins and those bacteria or whatever else is in that food to just sit there and multiply the bad bugs and just release toxins and chemicals into our system that we can't handle, and also release them, cause inflammation, local inflammation inside the lining of the gut, especially the colon, which can lead to the polyps, which can lead to, of course, to colon cancer. So I think that having that fiber, a regular intake of fiber, will help to move things along, and also help to make the inner lining of the gut or the colon more healthy, shall we say?
Absolutely, you are dead on. Absolutely, that is exactly right. I mean, helping the things move along, because when you eat, when you eat beef or lamb or even pork, it's your body has a harder time breaking it down and moving it along. And so that some of that is like just sitting there and slow. So being constipated is probably not good for your health. It's not, it's not fun to experience, but it's also not good for your health. You want things to be moving along, you get the nutrients out, and then expel the rest so it doesn't bring you down. So I think you're absolutely right.
But one of my rituals at night, as many times as I can remember, I take the fiber, a glass of water, powdered vitamin C, because they find that's important, and vitamin D. I don't know if studies are now showing that the bacteria need vitamin D to do their work.
Right.
The probiotics. So feeding them with vitamin D as well as the fiber and the vitamin C helps a lot. And then they also in turn help to make vitamin B, some forms of vitamin B, I guess vitamin B12 and all that. But they need the vitamin D. They need adequate amounts of vitamin D to thrive and do their work. So super important to take some of these things. I mean, I try to think about what can we do at nights to optimize the healing, the immune system, the reparative work that the body is doing while we're sleeping at night.
It's true. And you think about the times when you have woken up in the middle of the night, it's usually related to difficulty digesting things, right?
Right, exactly.
It's like you're having trouble digesting something. So really eating something, what you eat can impact, the restfulness of your sleep, which is linked again to immunity and to, cancer prevention, all those things.
Which is one of the reasons why, speaking about eating at night, it's recommended now that you tend to shut things down by 7 o'clock. Okay, some people say 8 o'clock, but 7 o'clock, you want to have your last meal. Some people say, by the way, they say you can eat cheese before you go to bed, and that doesn't cause any insulin boost. I know we haven't talked about insulin, but it won't affect things much. But 7 o'clock.
And they also say exercise, walking helps the digestive system. And so some people are constipated because they don't move, they don't do anything. Right. So you want to have a chance to go out and just kind of walk around the block, or do a little walking, or walk on a treadmill or something, so you can get a little bit of exercise. That helps your digestive system sort of wake up and helps motility. It helps just move things along.
Right. And then it gives you so at night, I think they say between 10 o'clock and 2 o'clock is the optimal time for reparative sleep. So they say before 3 hours. I think that's how they came up with 7 o'clock. So 3 hours before you go to bed. Obviously, most people don't go to bed at 10 o'clock. I certainly don't go to bed at 10 o'clock.
No, I don't either.
That's why they say so 10 o'clock to 2 o'clock is the best time to have your sleep, the way you can get the most from your sleep. And make sure, folks, now that we're talking about sleep, make sure you sleep in a dark room, cover your eyes completely. Maybe if you can get one of those eye masks. I got one. I got one here. I use it before I go to bed, just to cover my eyes, because that's when your body produces melatonin, which helps to make you sleep, helps your body relax, and it also helps in the repairing of your brain and damaged tissues in the body. Melatonin is such an important thing. It doesn't get secreted much if there's a lot of light in the room. So it's best you cover your eyes, make it as dark as possible.
Right. No sleeping with the TV on, right?
That's right. No sleep with those flickering lights, TV, the noise and all that will mess with your sleep. No cell phone next to you. I know we all do that. Keep everything as far away, all these EMFs as far away as you possibly can.
Right.
Yeah. So colon cancer, I think we've kind of talked about this. We're going to have to leave the lung cancer and smoking to another topic, because I'm looking at this now. I think, it's just 15 minutes though. No, that's not. No, we have time. I think we have time. 15 minutes. Okay. All right. You want us to just talk a little bit about the lung cancer?
Sure. Well, lung cancer really is related to.
Hang on. Let me introduce that.
Sure.
All right, Dr. Greg. So let's talk about lung cancer, and let's see. And is it worse in Black people?
Well, yes. Like everything, right?
Like everything.
People get lung cancer with less burden of smoking, right? And so, for however much smoking causes lung cancer in white people, Black people who smoke less will get the same lung cancer sooner, right? And so the burden of lung cancer is worse on smoking Blacks. Now, the good news is that we tend to smoke less cigarettes. Overall, we smoke less than white people. We smoke later. We tend to start smoking later, and we smoke less. But the bad news is that less smoking still still causes a disproportionately high amount of lung cancer. So, so there's something about it. And so, the ultimate sort of putting side by side is that, a lot of my patients smoke marijuana, right? There's no increased risk for lung cancer in people who smoke marijuana. So if you think, it's just the smoke that causes lung cancer, just smoking smoke, right? It's not just smoke, because smoking marijuana doesn't give you an increased risk for lung cancer, but smoking tobacco does. And so that's an age-old question as to why. Now, smoking marijuana does give you chronic bronchitis, and it can give you a cough and all those things, but it just doesn't give you increased risk for lung cancer. And so people who smoke cigarettes or smoke marijuana in wrapped in tobacco, blunts. African Americans tend to smoke more marijuana wrapped in tobacco. And so that gives you the increased tobacco, and it also causes you an increased problem with stopping smoking because the tobacco is way more addicting than marijuana. So if you're used to kind of smoking it wrapped in tobacco, that's going to be a harder sort of thing to navigate, because historically marijuana is not as addicting as tobacco or alcohol or things of that nature. But we kind of got to side off. But just know that smoking tobacco is associated with a way increased risk of lung cancer, and the majority of the lung cancer burden we see is related to that smoking. So whenever you can stop smoking, that is going to help you to prevent lung cancer. Now, again, here in the States, we do lung cancer screenings for people who have 25 or 20 pack year histories. So if you smoke more than a pack a day for 20 years, you're at really increased risk for getting lung cancer. And so we would screen those people annually with a CAT scan, a CT scan, and see if there's anything there. And they've done great work with saving people, curing people. I saw a man yesterday who had prostate cancer and lung cancer, and he's been cancer free for like 6-7 years. So
wait a minute, he had both at the same time?
He had, in close proximity, he had prostate cancer, and probably 18 months later they diagnosed lung cancer. Yeah, so I mean, he had them at the same time and survived both, and just stopped smoking 6 months ago. He smoked up until 6 months ago, so he survived both and started smoking again. Which is amazing. I just saw him yesterday, and he said, "I finally stopped smoking 6 months ago."
What got him to stop?
It's funny. He said he was smoking and he didn't like the taste, and he just finally said, "I'm done with it." Finally, some resolution he came to. But whatever you can do to try to not smoke tobacco, that's what you would do to decrease. So if you decide you're going to wear a nicotine patch instead of smoking, nicotine patches aren't associated with increased risk for lung cancer. That nicotine may put you at increased risk for some other cancers, but not necessarily lung cancer.
Really? Huh. So what is it? Is there something in particular in the cigarettes that causes the lung cancer? It's not a nicotine, obviously. Nicotine just keeps you coming back for the smoking.
Right.
What are
there's
they?
A lot of hypotheses on that, right? Some people think it might be pesticides that are put on tobacco plants, because what kills a tobacco, bugs love tobacco, right? And so when they eat the leaves, then you don't have your crop. And so the belief that in some countries that aren't monitoring pesticide use, there's a lot of pesticides being put on plants. Those pesticides stay in the soil, stay in the dirt by the plants. And so whatever grows out of it, even if you use the pesticide 40 years ago and DDT and all those other things were used, if it's still in the soil, it's still in the tobacco that's grown out of it. And then that some people think that it's not the plant that causes it, but it's just the pesticides that they have to use in order to keep tobacco plants from getting eaten alive by insects.
Right.
But either way, but apparently that doesn't happen as much with marijuana.
Interesting, really. Huh. Well, okay. Well, these modern day agricultural practices are causing a lot of damage, I gotta say, unfortunately. Absolutely. But you can't live with them. You can't live without them. That's just the truth. So, 2 questions: secondhand smoke, where does that come in? And number 2, what can smokers, for example, do to reduce their risk, or maybe I like to use the word strengthen their lungs and their immune system so that they can reduce their risk, even if they can't stop. At least what can they do to mitigate the effects of this habit?
Yeah, I think people who smoke need to get used to smoking outside of the house, right? So if you can go outside rather than inside, you can minimize that secondhand smoke. Because there's all sorts of data related to secondhand smoke increasing people's risk of lung cancer. So people have lung cancer, I never smoked, but we find out they had a spouse who's dead, more than likely, who smoked for many years in the same room with them. A lot of my patients, I insist that if you're going to smoke, go outside and smoke. is at least
Right.
make it uncomfortable for you to do that, or go, go in the basement in a room that doesn't draw, air from, and smoke down there, because the secondhand smoke does put your people who you live with at increased risk. It has the children of smokers have much higher rate of asthma and breathing problems compared to children of non-smokers. And so that's not really not debatable. Aside from that, people who normally successfully stop smoking because of the nature of nicotine are able to stop cold turkey. They're not able to stop by decreasing they're not able to decrease and stop. Most of the people who are successful stopping have just stopped. And so I tell patients when they
Just willpower? Just willpower?
well, I tell patients that you use an infection to your advantage. So if someone gets a cold, you get a viral infection, and that's an opportunity for you to stop smoking. You're kind of sick. Your cigarettes don't taste right. Just stop smoking. Certainly, vitamin C. There's some supplements you can take that will increase your success rate. Vitamin C is certainly associated with more success of people. And people, when they stop smoking, they need to take more vitamin C for that. But in generally, it's people have not been successful decreasing their smoking to a stop. They're more successful just stopping and then using it. I went in for surgery, so I couldn't smoke, so I stopped smoking. Or I got sick. I was in bed. If you stop for 3 days, those are the 3 hardest days. Just don't start up again. Just at that point, if you've gone 3 days, those are the hard days. The second day is the hardest day. Second day is the hardest. First day is the second hardest. The third day is the third. And after that, you're home free.
It's like fasting. I remember when I was in my 7 or 8 years old, my dad used to smoke a lot, and I had read in Time magazine that smoking was bad and all that. So I would sneak up and then take his pack of Benson and Hedges. I don't know if you guys have that over here.
Sure.
Best.
Yeah.
Oh, you do? Okay. So I'd go to the backyard and tear them to pieces and all that. And I mean, it worked for a couple of days. And then finally he's like, who's doing this? Of course, I denied it. And I think he set a trap on me. Foolishly enough, I went after it. He put it right somewhere where everybody could see. I went after it. And when I was doing my thing in the backyard, I just heard him shout my name. And I knew I was in trouble. But then, I mean, he asked me why. I explained to him I didn't want him to die.
Right.
And he was good about it. So I mean, he didn't stop. He didn't stop until much later when he was ready to do it. And he just stopped cold turkey, like you said. He just stopped cold turkey.
Right.
I've always wondered about that. People can just stop like that. I know for people who have had heart attacks, that's like a real shaker. It really shakes them up, and they change their lifestyle. But cigarette smoking, it hardly ever happens that way. That they have a major scare like that.
Right.
Unless of course it's lung cancer. So some people can do it, I guess. Yeah, that's interesting. Okay, great. So so vitamin C, yeah, you brought vitamin C, and I read somewhere that each cigarette you smoke takes about 25 milligrams of vitamin C from the body.
Wow.
And yeah, and the recommended dose of vitamin C, again, that RDA, I think is in some cases ridiculous. Is that the recommended dose is like 90 milligrams of vitamin C a day. Well, that's nowhere near enough. Your body needs so much, especially if you're a smoker, because vitamin C helps to form collagen, which helps to repair the inner lining of the lungs and allows for the air. I mean, not just the inner lining of the lungs, but everywhere. Collagen is everywhere. But I think it reduces the rate of inflammation once you and the irritation that comes from smoking and other things I inhale. It actually helps in the protective immune system barrier. I know vitamin A too. They say vitamin A is good for the lung function. Mm-hmm. Zinc, I heard about. I think they said zinc deficiency is responsible for over a sixth of all lung infections and all that. Mm-hmm. So I would say A, C, D, of course, for lungs, and zinc. Yeah. Especially if you're a smoker, it would be good for you to supplement with these things, just as a safeguard and to mitigate against the harmful effects of smoking.
Absolutely. No, that all sounds like sound advice to me.
Oh no, looks like our time is up again, Doc. So I think we're going to have to wrap this up. Any final words you want to give our audience?
No,
That's
I,
good.
I think it's important to, like I said, do what you can to exercise, do what you can to get the right amount, make sure whatever you're at increased risk for deficiency for, make sure you replace it. That's only the smart approach.
Mhm, mhm. And again, your book, and I know you recommend certain supplements on your website for Black people,
Right.
which is how I in touch
Right.
with you as
Yeah.
well.
After my website's drgreghall.com. I've got information about diabetes, hypertension, all kinds of good stuff, as well as sequence multivitamins, genetic sequence multivitamins, which again are available here in the States.
Absolutely, and I have one of them here, right here, folks. I got them, and I've been using them. I love them. All right, thank you again, folks. Thanks for joining us. If you have any questions, go to our website, brainandbodyfoundation.org. We archive all these videos, so you can go to our YouTube channel. We also cut them into bits, so I have my volunteers and my staff. They listen to these videos, and then they take little pieces out, and then they can put on in bite-sized chunks for people to watch on social media as well. So stay tuned and be sure you subscribe everywhere you see us. God bless. Have a great day. Have a great week. Take care. Bye.